I find that when we package it, and where we wrap around coaching and we wrap around preparatory classes and bridge classes, and we wrap around the next steps to actually bring the college credit and the college classes as an integrated model with the technical piece, we have much more utilization, and many more people actually being successful in moving there than we do just having standalone programs where people are kind of choosing it on their own. And certainly there's a population that does that. But what we reach in this other model is a population that normally wouldn't do that. So through our behavioral health program, which includes work-based learning, and our traditional program, through this marriage with Philadelphia University that we've had, in the last 3 years now, we've had 35 associate degree and 5 bachelor degree graduates. We have half of the jobs to careers students now in college programs. That wouldn't happen if we hadn't packaged it.
Surgery tech is offered as a credit or non-credit. As a credit program, it could take 5 or 6 years, but there's an industry-approved and certification that's offered in 13 months. And we were able and successful to get the community college to offer a session just for us. And we negotiated a price. Our job was to aggregate demand, set up the session. I guess there were 20 seats, 6 hospitals participated. Their deal was to advance candidates, guarantee clinical rotation space, pay for credit or non-credit, and if necessary, for the benefit of the college, if there's a shortage of faculty, to participate in the teaching.
In a traditional educational setting would cause failure. People would be left behind. We've learned a long time that it's about individual learners and not about the instructional dynamics. It's about them, not us. And that's a point of view that's not necessarily obvious in traditional educational settings or even training. So once again, it's not about the instructor, it's about the learner. And by doing that means it takes a lot of patience and flexibility, but working in a cultural setting like Alaska and some of our small communities, it's a real advantage because it's not a competitive educational environment. So as each learner enters their world or their particular emphasis area, as we're moving on, they may master it faster than another, and they may have, but they're helping their others with it too. Nobody's left behind. And we always use this story sometimes about in Alaska. You've heard about the muskox that sometimes back around their young ones as the wolves are chasing them, so they're facing out and they're fighting off. So one of the things I think that's really happened culturally in the sense of education is that we developed a sense of learning community. Also, in a systems kind of view is we developed something called portfolio process, so that as a person goes through their training and learning over period of time, they are capturing what they've learned and owning what they learn. And you have the academics and the competencies and all those sort of things that we check off and so forth. But just as important as a whole human being. So they include stories about their family, stories about who they are, and the idea, the pride of self-assessing and self-owning, if you will, who they are and what they are. And I'd say the portfolio process is something that they'll always take with them. I say it's a living book that someday you'll show your grandchildren. It's a story, it's your story, your professional story and personal story.
So moving to a seminar format, adult learning, adding basic skills, adding support services that aren't traditionally provided on an individual basis, creating individual educational plans, and then also morphing it for other disciplines. This is the only program I know of in the country where you're taking an 80 credit class over 20 months, doing it work-based with only a third of it in seminar and the rest online and work-based. I don't know anywhere else that's doing something like that. Same with some of the other programs. So it does transform education, and it changes how we see the employee learners. They're not students, they're employee learners. They're adults working hard to be successful. So I think it's very transforming both for the healthcare industry and for the educational partners.